On this Wednesday night, the first COVID-19 vaccine approved for use on Canadian children aged 12 and up.
And marks a significant milestone in Canada's fight against the pandemic.
Canada reports 2 new deaths linked to the AstraZeneca shot. Alberta's latest pandemic protocols.
The community can't get gas because of your guys' bullshit rules.
Rising backlash to the restrictions, and will they be enforced? The declining mental health of Canadians.
It needs to be talked about a lot more than it already is.
Plus, incoming and out of control, the space junk hurtling towards Earth.
Global National with Donna Friesen.
Good evening and thanks for joining us. Canada has become the first country in the world to approve the use of a COVID-19 vaccine in children as young as 12. And provinces are already making plans to administer it. Health Canada has reviewed data from clinical trials of the Pfizer BionTech vaccine and deemed it is safe and effective for 12 to 15-year-olds. Phase 3 clinical trials were done in the U.S. More than 2,200 kids aged 12 to 15 were enrolled. Over 1,000 received the Pfizer BionTech vaccine, and the other half received a placebo. 18 in the placebo group got COVID-19. No one in the group that got the vaccine became infected, and the only side effects were temporary and mild. Almost immediately, some provinces have announced they will make kids 12 and older eligible for the Pfizer BionTech vaccine as soon as Monday. But with limited supply right now, they'll have to get in line behind the adults. Eric Sorensen has our top story tonight on kids, vaccines, and the timeline to get them protected.
The timing couldn't be better. As Canada prepares to receive more than 8 million Pfizer vaccine doses this month, the Canadian government has become the first to approve Pfizer shots for the youngest age group so far, 12 to 15-year-olds.
Health Canada applied its science and evidence-based review process and required that the same high standards were met. While younger people are less likely to experience serious cases of COVID-19, having access to a safe and effective vaccine will help control the disease's spread to their families and friends.
I have no hesitation about getting the vaccine for my children.
Stacey Carroll has 2 teenage daughters doing school online and believes vaccinating them will help return life to normal sooner.
Even though many children are not getting severely ill, I don't want to take that risk with my kids. And by having them protected, they're protecting themselves and they're protecting other people in the community.
Some provincial governments already plan to inoculate teens before the school year is out, including Manitoba, Alberta, and Newfoundland and Labrador.
Immunizing this age group will be an important part of achieving greater community protection, and plans are in development to ensure first dose of vaccine before the end of the school year.
Ontario is doing the same. The biggest province is expecting more than 3 million Pfizer doses by the week of May 24th and more than 7.8 million by the end of June, enough to expand eligible age groups to include adolescents.
The plan would be to start the vaccinations in schools, the first dose, and then have the second dose administered before a return to school date in September.
One infectious disease specialist cautions against inoculating healthy teens ahead of people at higher risk.
I think one of the big things right now is we still do want to be getting to the highest risk people and the highest risk populations first. And thankfully right now, adolescents don't comprise that population.
Pfizer, meantime, hopes to get approval for its vaccine for children aged 2 to 11 by September. Other manufacturers are also testing children. But for now, expanded age groups for Pfizer matches up with Canada's deliveries that are primarily from Pfizer. Eric Sorensen, Global News, Toronto.
2 more Canadians have died from extremely rare blood clots linked to the Oxford AstraZeneca vaccine. In New Brunswick, the chief medical officer says a person in their 60s developed symptoms 7 days after receiving the first dose in mid-April. The person went to the hospital and died 2 days later of a condition known as vaccine-induced thrombotic thrombocytopenia. 44,000 doses of the AstraZeneca vaccine have been given in New Brunswick.
These are not unexpected outcomes based on the statistics, but they are tragic and they are sad, and we take them very seriously, and we will continue to evolve as the information becomes clear to us each passing day and each passing week.
And late yesterday, Alberta reported its first death linked to the AstraZeneca vaccine. It was a 52-year-old woman who was vaccinated in late April. That province has administered more than 250,000 doses of the AstraZeneca vaccine. Alberta's Chief Medical Officer of Health says people aged 50 to 59 are 350 times more likely to die from COVID-19 than they are to get a blood clot linked to the AstraZeneca shot. Alberta's Premier is counting on vaccines and the latest restrictions he has imposed to stop the spike in cases and deaths in that province. Jason Kenney says he has no tools left to prevent the worst-case scenario unfolding in the healthcare system, though his many critics say had he acted faster and imposed stricter measures sooner, Alberta would be in a much better place. Sarah Offin has the story.
This is disgusting!
A heated confrontation early Wednesday morning as officials with Alberta Health Services changed the locks at Whistle Stop Cafe in rural Alberta. The business officials say has flouted public health restrictions, offering dine-in service for months.
You're protecting a government that's not upholding our rights.
Restriction backlash has been swift after Alberta announced its toughest measures since last spring. Schools are closing, retail is limited, and restaurants with newly expanded patios are takeout only. But businesses considered essential, such as work in Alberta's oil sands, continue to operate. This despite outbreaks at more than a dozen oil and gas work sites and hundreds of workers infected. That has some calling for a complete shutdown, while oil prices are finally on the rise.
What we're seeing unfold in the oil sands related construction camps is nothing short of a crisis. This is a concern for Alberta first and foremost, but it's a concern for the whole country because many of these people at the end of their rotations, they fly back to their provinces.
There is already significant pushback to the measures now in place. More mass rallies are planned for the weekend and COVID fatigue is a growing reality.
I'd like to kind of be able to get back to seeing my friends and be able to hang out with relatives and family and stuff.
You do all the best you can. You wear your mask, you stay at home, you keep your bubble small, and it's just, I don't know why it's continuing, right? It's just really, really upsetting and frustrating at this point.
Less than 16 hours after restrictions were announced without the opportunity for reporter questions, Albertans were met with an announcement that everyone 12 and over will be eligible to book vaccine appointments by Monday. So why wasn't that announced alongside restrictions?
We didn't want the vaccine announcement to be lost in that mix.
By the end of the month, Alberta is expected to surpass 50% of the population vaccinated, while a race against both variants and resistance continues to rage on.
If you think this is going to stop me, you got another thing coming.
Sarah Offin, Global News, Calgary.
It is Mental Health Week, and in the heart of the third wave, talking about mental health and the toll the pandemic is taking is more important than ever. New polling from Ipsos shows that is happening. As Abigail Beeman explains, experts hope it means the stigma around mental health is shrinking.
Samantha Lederman was a new college grad with her first so-called adult job in event management. The pandemic stripped that away. Mental health issues she'd struggled with for years became worse.
It's been way too long since, I have been able to go and sit in the cafe and just have a positive atmosphere or get away from home or get away from the environment that could be causing me anxiety or causing me to be irritated or depressed because it's the same four walls.
She's had some virtual support through a young adult mental health center, Stella's Place, which she credits with saving her life. But now, in the third wave, she can't wait longer for in-person help.
I sound very strong, but definitely, like I said, there becomes a time where my anxiety and my depression is going to overtake me.
According to new Ipsos polling, Lederman falls into all four of the hardest hit categories for mental health: women, younger people, low-income Canadians, and people living in Ontario, Alberta, or the Atlantic.
We're kind of taking the fact that our plans didn't work out as much really hard.
On the whole, the number of Canadians facing mental health challenges continues to climb. Half of those surveyed deemed at high risk, up from 33% when tracking began in 2015. But the survey also found more Canadians are now willing to talk about it, 53%, with friends, a healthcare provider, or by posting on social media.
I think because so many of us are impacted by it, it is a lot easier to respond honestly about what we're experiencing, the stress and the impact on our well-being.
Experts are still seeing increases in appointments and warn the impacts could be long-lasting.
There's generally a tendency to think that things will get better, and it's usually once we can let our guard down,
post having to be in survival mode that we see a lot of stuff come up for us.
As for Letterman, she's launched a side business as she looks for work.
It is 150% just as important as talking about a vaccine, talking about a third wave.
And she's going to keep talking about mental health. Abigail Beeman, Global News, Ottawa.
Well, we get caught up in which vaccine we will get here in Canada and when we'll get it, but many countries are nowhere close to where we are. And then there is India. It is still caught in a catastrophe. Canada is trying to help. We're sending 25,000 vials of the antiviral drug remdesivir and as many as 350 ventilators from the National Emergency Stockpile. It is something, but it's not enough. India recorded 382,000 new cases of COVID-19 today, and nearly 3,800 more people are known to have died from the virus. The trajectory is straight up. Over the last week, India accounted for 46% of all new COVID-19 infections around the world and 25% of all new deaths. Those are the official numbers. The real toll, including the people dying at home, is likely far higher. As Redmond Shannon reports, hospitals are now taking legal action to try to force the Indian Prime Minister to do more.
Junior doctor Rohan Agarwal gets himself ready for another long shift. The 26-year-old medic isn't yet fully qualified, but he's dealing with a crisis unlike anything any doctor here has seen.
What job we are assigned is what is to be decided by God. Yeah. Whom to be saved, whom not to be saved, and we are not made for that. We are just humans. Yeah.
Amid the staggering infection numbers, the oxygen crisis continues. Hospitals are taking the extraordinary step of going to the courts to force the government to act.
It's extremely unfortunate that our central government and our state government cannot find it in themselves to bury whatever issues they may have with each other, politically or otherwise, and work together just to save people's lives.
I think it just reflects the frustration, quite frankly, that hospitals feel, look, our last resort, is throw the dice, go to court, and hope that the courts will help us. It's really a tragic commentary.
Professor Vivek Dahejia says Prime Minister Narendra Modi's handling of the crisis compounds his mistake of declaring victory over the virus earlier this year.
I think the fundamental problem is that there is a complete absence of a national response, of a nationally coordinated response.
Another political blow for India Wednesday. Its foreign minister, seen here in London on Monday, is self-isolating after 2 members of India's delegation tested positive for COVID-19 at the G7 foreign ministers meeting. Organisers are hoping infections don't spread to other national delegates. This week's event serves partly as a dry run for next month's G7 Leaders Summit here in the UK. Redmond Shannon, Global News, London.
There has been a breakthrough on the issue of vaccine patents. The U.S. has announced it now supports a proposal to waive intellectual property protections to help boost global vaccine supply. Our Washington Bureau Chief Jackson Prosco is following this. Jackson, what prompted the U.S. to announce this now, and what does it mean?
Well, Donna, rich nations like the U.S. have faced pressure to do this for a while now. And so today, the Biden administration relented to the pleas coming from more than 100 other countries, saying it supports a World Trade Organization effort to waive these patent protections on COVID vaccines. Now, the goal here is to allow nations to produce more vaccine using the formulas and manufacturing techniques that have already been developed by pharmaceutical companies. The U.S. Trade Representative says that the extraordinary circumstances of the pandemic call for such extraordinary measures. Now, Canada has previously been accused of being too slow to act on this issue. Today, Trade Minister Mary Ng tweeted that Canada actively supports the WTO efforts to accelerate global vaccine production and distribution. Donna?
Jackson, what will this mean in practical terms to the many poorer countries who have vaccinated very few or, in some cases, none of their people and can't afford to build their own vaccine production facilities?
Well, right now, no big difference. These WTO negotiations could take weeks or months, and even if they are successful, it is questionable as to whether developing nations could suddenly start manufacturing these highly complex vaccines. There are actually plants right here in the U.S. that are even struggling with this right now.
By the time you then
gets set up to get the technology transferred, you may be going into the end of 2022, the beginning of 2023, at which point a lot of people will have died.
And of course, Canadians wondering if this would help the situation in Canada. Members of Canada's vaccine task force say that technology transfer is such a slow and complicated process that waiving the patents would not have improved Canada's supply this year or even next year. In short, it may help in the very long term. It does nothing for the immediate goal of vaccinating as many people around the world as quickly as possible. Donna?
Okay, Jackson Prosco in Washington, thanks. It has taken home fitness fans by storm. Now Peloton is recalling tens of thousands of its treadmills. Find out why, coming up. Peloton is recalling tens of thousands of its treadmills less than a month after denying they were dangerous. They've been linked to the death of one child and injuries in 29 others. About 125,000 treadmills are being recalled. The Tread model has a touchscreen that can detach and fall. About 5,400 of them were sold in Canada. And the Tread Plus machine is also being recalled because children and animals can be pulled underneath it. Peloton says it is not sold in Canada. Less than a month ago, the company said consumer warnings about the products were inaccurate and misleading. There will be no immediate return to Facebook for former U.S. President Donald Trump. The social media giant's oversight board ruled the company was right to suspend Trump after he expressed support for rioters at the U.S. Capitol in January. The oversight board, an independent committee of 20 outside experts, said Trump did create an environment where a serious risk of violence was possible, but it also called the indefinite suspension arbitrary and has given Facebook 6 months to come up with clear rules and penalties about what is and what is not acceptable. That puts the ball back in Mark Zuckerberg's court. Trump called today's ruling a total disgrace and said corrupt social media companies must pay a political price. Trump was also cut off from Twitter and YouTube in January. And you may have seen this interesting photo. Someone called it, "Honey, I Shrunk the Carters." President Biden and his wife visited former President Carter and his wife Rosalind in Georgia last week. And while they look a little out of proportion, or like the Carters live in a dollhouse, photographers think it's a bit of optical trickery as a result of a strong flash and a very wide-angle lens to capture them in a tight space. And of course, someone on Twitter helpfully fixed it. Ditching food bans still ahead. The new school recommendations to keep kids with allergies safe at school. New guidelines are emerging about banning nuts and other allergens from schools and daycares. An international team of allergy experts reviewed scientific evidence and found blanket bans on specific foods like peanuts or dairy do not reduce allergic reactions. Instead, the blanket bans result in children failing to learn how to safely manage their allergies. Researchers are recommending schools focus on personalized plans, allergy and hygiene education.
Is again reinforcing the principles of good training of the teachers, recognition of signs and symptoms, an anaphylaxis action plan for each student, good hand hygiene, as well as tabletop, supervision of young children eating lunches and whatever else is eaten within the school.
Schools are also being encouraged to have their own supply of EpiPens. The new guidelines have been endorsed by several organizations, including the Canadian Society of Allergy and Clinical Immunology. Rogue rocket next, tracking where it might land. There is aging wine, and then there's aging wine in space. Christie's Auction House is selling a bottle of French wine that spent 14 months on the International Space Station as part of a study of food and agriculture. The bottle is one of 12 that was sent into orbit, and the person with the winning bid will get a regular bottle too, just for a comparison. The wine might fetch as much as $1 million. Well, it's a truism to say that what goes up must come down, and when it comes to old rockets, there are some serious risks. An unmanned Chinese rocket is hurtling its way back to Earth right now. It is out of control, and no one is certain where it will land. Mike Armstrong explains what you need to know.
There was no problem with this launch. It went off last Thursday without a hitch. The problem came when the cargo part of the rocket unhitched from the main booster. It just floated away. There was applause back at Mission Control, but concern from others in the space field.
I guess this is a situation which could have been avoided.
Paul Delaney teaches astronomy at York University and is a little shocked by what China's done. That booster rocket is visible from the ground. It's in a temporary orbit around the globe. It's going to come down. The issue is no one knows where.
The chances of hitting a person, hitting a house are small, but they should be infinitesimal. You should be able to control the reentry, and that is not the case.
Now, the rocket booster is 32 meters long and 5 meters in diameter. It's not flying like an arrow, it's tumbling as it goes, basically flipping over and over.
Flashing.
That's the reason it brightens and dims in the sky. It catches more of the sun's light as it tumbles.
How cool is that?
It's really negligent by international standards.
Harvard astronomer Jonathan McDowell says China's been somewhat reckless. For a couple of decades, the international community's been careful when sending up something so big. They make sure there's a planned and controlled reentry. Well, the Chinese Long March 5B rocket has flown twice, and both times it's meant an uncontrolled reentry. A year ago, another booster rained debris over about 160 kilometers of land in the Ivory Coast. So why take the chance?
I mean, it's cheaper. You know, they may have just felt, yeah, Earth is big. It probably won't hit anyone. Let's not bother.
Now, the booster's orbit isn't taking it over Canada, so it won't crash here. And McDowell says most of it'll break up on re-entry, so it's not a huge disaster in the making. It's not good if it's headed towards you, but not, he says, evacuate the city bad. Mike Armstrong, Global News.
Well, that's a relief. That is Global National for this Wednesday. I'm Donna Friesen. Tonight's Your Canada is this Bob of Seals off Sechelt, BC. Yes, Bob is an actual term. I didn't just name them all Bob. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.